A beautiful day mga kasiyase. Welcome to the Certified Skin Authority. I'm your host, Dr. Contessa, giving you updates on the science of skincare, anti-aging medicine, laser technology, and aesthetic dermatology. Sa nakaraang episode, ating pinag-usapan ang treatment na non-surgical para sa mga nagkakaroon na ng pagbagsak o paglawlaw ng balat sa pisngi, sa ilalim ng pisngi, at sa leeg. Ito ang Ultherapy. Ang Ultherapy ay gumagamit ng ultrasound technology na kung saan nagkakaroon ng skin tightening, skin firming, and skin lifting. Mainam ito sa mga mild to moderate skin laxity. Paano naman kung very severe ang skin laxity? Maaari pa rin ang Ulthera, pero merong mas mabisang non-surgical minimally invasive treatment para sa mga severe skin laxity. Ano nga ba ito mga ka-CSA? Ating abangan sa pagbabalik ng CSA Certified Skin Authority.
Hi, I'm Chris Kajang. To many of you, I'm sure, my dear viewers, I'm known as Father Chris or Among Chris because everybody knows, it's public knowledge that I have served the Archdiocese of San Fernando, Pampanga as a Catholic priest for 15 years. But after 15 years, I decided to try another life and went on with my music. So, my career now, my whole life, my whole energy, my theological energy, my spiritual energy are all now focused on the creation of music, the creation of lyrics and music. Ako rin po ay host ng isang show sa kabilang network, ang Musical Moment with Chris Kajang sa CLTV 36. But why am I here today? Last January 7, this year, I turned 56. When I look at myself at the mirror, I'm beginning to realize and figure out that I'm not getting any younger. Imagine 56, 4 years away from being a senior citizen. So, I think as far as I'm concerned, the projection of my face, the projection of my personality is very important because I'm hosting a television program. I'm here at CSA now because I know the person behind this derm center. They were students when I was chaplain at Angeles University Foundation. And I went to her, and she will try to do something about my face, so that hopefully, and I'm sure, knowing her, I am in good hands. There will be a transformation of my face. Although some people are trying to, I don't know if they're making bola, no? They say that I do not look my age, but as I have told you, looking at my face at the mirror tells me that I am really 56 years old. I'm excited with what Dr. Contessa will do with my face.
And we're back mga ka-CSA. Ating pinag-uusapan ang non-surgical facelifting. So we are privileged, we are blessed to have with us Among Chris Kajang. Welcome, Among.
Thank you, Doctora. Thank you.
Yes.
Ang bait mo naman.
Well, actually,
what an opportunity.
Opo, mga ka-CSA, I can recall kasi po when I was in high school days.
High school, yes.
That was 1980.
87, 88, 89.
Graduating na ako nun, Among
Oh.
Siya po ang aming university chaplain din.
Nako, you have defined the age gap.
Pero you were young then, Among, di ba?
Yes.
Kasi ang naaalala ko po talaga sa inyo, marami kayo pong mga fans. Among my classmates, marami pong gustong nakikita si Among. Of course, during mass, pinakikinggan namin, siyempre, yung mga messages, di ba? Napakagaling pong mag-deliver ng mga godly messages po. diba? Blessed naman po din kami. And alam ko yung features ng mukha ni Among kasi, nung time na yun, comparing right now, bakit parang bata pa rin po ang itsura?
Doktora, I'm 56.
Oh, diba? Mga kasi, tingnan nyo naman po.
I'm 56. Pero sabi nga, pag malapitan, tumitingin ako sa salamin, talagang nahalata ko na there's something going on in my face, with my face, you know. But, you know, I'm still happy with it. But
Yes.
I'll be happier if kung
Pero,
kung
yun nga
merong
po
mangyayari.
Right. Pero compare naman dun sa mga may age na nasa 50s naman po. Looking at you, okay, we can see some fine lines, we can
You're
see some,
correct.
yung mga nagsasag yung skin, pero in your case po, parang nasa mild lang naman eh, di ba?
Palagay ko, malaking tulong, malaking bagay ang ginagawa ng music. No?
Oh, yes.
When I look at the faces of my fellow musicians,
Yes.
especially those who are older than me, I
Right.
realize that music really helps a lot. You know?
Correct.
Kasi ang music, ini-involve pati sa circulation ng katawan. Alam mo
Right.
yun? Pag gumagawa ako ng lyrics, gumagawa ako ng musical patterns,
Yes.
napapansin ko, everything about me is involved. And I think that contributes.
Parang ang music ay isang form of medical therapy. Stress relief.
Yes, it's kaya nga meron kaming
relaxation.
meron kaming music therapy workshop eh.
Yes. O, di ba?
Kailangan i-partner natin sa
Pwede po.
sa
That's why po kasi Among, like here, when we have patients na nagpapa-facial treatment,
Yes.
meron kaming background music,
Oh, okay.
soothing music. Sabi nga nila nare-relax sila. And of course, yung circulation natin, kasi yung iba, tumataas na yung blood pressure. But of course, pag nare-relax ka, yung blood pressure natin nasusustain dun sa normal level. Hindi tayo stressed, hindi tayo pressured. Yan. And of course, pag stress lagi ang system natin, it also creates a toll on our body as well as on our skin.
I know. Yeah,
Yan.
right.
Ayan na yung nagbe-breakdown na yung mga collagen, ang ating elastin, yung lahat ng structural framework ng skin, yung responsible for holding or tightening or firming our face, yung jawline. Kaya yung iba nga po, pagka tumatagal na, iba nga as early as 30s, 40s, nakakapansin na ng mga jowls, iba turkey neck, dito sa may neckline, nagsusag na yan. Pero si Among, look at Among naman, di ba? Di ba? And the thing is, of course, we are godly, we pray a lot, and of course, you're into music.
And meditation.
And meditation.
Kasi when you once in a while silence yourself, you know,
Right.
and commune with yourself, commune with God, nakakatulong talagang malaki yun na ma-maintain mo ang, alam mo, yung proper disposition
Correct.
sa
I
buhay.
believe in that, Among. Totoo po yan. Diba? Yung holistic approach, the
Correct,
totality
correct,
of our
correct,
being.
correct.
It's from the inner person that we have. And nagre-radiate
Yes. And I think
panlabas.
it's good na science has realized you know, the putting together of different kinds of ways on
Right.
how to cure
Yes.
a person. No? Kaya
Correct
pumasok ang music at ang meditation.
Correct yan. I believe in that. O, di ba? Of course, we also use science, of course.
Yes.
Isa ring tool ito for our health and also to sustain yung ating, of course, in our field, yung ating looks, yung ating appearance. And host din po, si Among Chris. So, importante sa kanya, napaka-presentable sa harap ng camera. Ayan.
Although sa kabilang network po yan, ano po, sa
Oo
CLTV
nga
36.
po.
Pero
Yes.
abangan po
We're
ninyo.
friends with them. Exactly.
I hope it's okay if I plug my show.
It's
no?
okay po. We're
Yeah,
friends
every
with
Sunday
them
po
as
yan,
well.
8 o'clock to 9 p.m. on
Yes.
CLTV 36, Musical Moment with Chris Katyan.
I think ako rin po mga kasisay, mag-guest din po kay Among next time. O,
Yes.
diba? We'll involve that.
Paawitin ko si Doktora.
Okay, I have to practice right now. You have to teach me, Among. So looking at Among right now, ayan naman po, nalaman natin ang sikreto. And of course, assessing si Among, makikita ko, mga ano lang, minimal lang eh. Yan sa forehead, sa sides ng mata, dito sa jawline. Medyo naglalax lang ng konti. We could say na moderate lang naman yung problem. Dito po, Among. Yan. Yung dito, yung konting dito, baka iwasan na natin po siyang medyo magsag or maging lax ng sobra. O, diba? Baka naman, kung 50s kayo ngayon, maging 40s na. O, diba? Ay, hindi lang. Baka maging 30s pa. O, diba? Ayan. And matatanong nila, ano pa bang secret ni Among? Hindi lang yung kanyang music. And,
Of
ang
course,
ating CSA treatment na rin also. Combination. We could say we can do combination. And of course, with this kind of treatment, marami pa rin kasi among yung mga ayaw ng surgery. So gusto lang nila yung basta ano lang, minimal lang, tapos walang masyadong mahabang downtime. And of course, importante, very safe, and as well as FDA approved naman.
Kasi takot sa surgery.
Exactly. Kahit po ako, ayaw ko ng hiwa, ayaw ko magka-scars, ayaw ko ng mahabang pahinga. We are all busy. So, mga ka-CSA, among, ating ipakita sa kanila, ano ba itong non-surgical facelifting treatment? We'll show it when CSA returns. We're back mga ka-CSA. We will now show you the actual procedure on this non-surgical facelifting. And so the one we will be presenting to you will be the so-called thread lifting or ultra VLIFT. Ito pa rin po yung made of mga protein threads. But this time we'll be using the so-called COG threads. Ayan, Among. Kamusta po kayo?
Okay naman.
Okay naman
kayo,
po.
How are you?
Okay na. I'm
Okay
good.
lang kayo?
I'm
Okay.
good. We're all good.
Okay. Let us be
So, actually, it's the first time that Among will be having treatments like this.
Yes.
Okay. So,
Never in my life.
Exactly.
Mm.
Wala pong mga naging Botox treatments, filler treatments, none at all.
Nothing
Even
of that
mga radio frequency. Pero diamond pill po, na-try nyo po. Mga facials, na-try nyo po.
I don't remember.
Pero before, di po ba, meron kayong sigurong mga nagpunta kayo sa spa,
Yes,
and then you
that's
had
right.
some
Yung
facials and
Correct.
yun po. So, right now, what we will be doing po kasi, yung dito lang sa part ng lower third ng face ni Among, kasi if we hold the skin, lax na rin po siya. So, we'll be doing tightening and firming dito po, Among. So, lower third lang po tayo. Kasi sa upper third, okay pa naman, acceptable sa mga men, okay, dito po sa forehead, it's accepted yung mga ganitong forehead lines. It adds to your masculinity.
Oh.
Yan. So, sa middle third natin, eye area, actually, I could recommend just minimal na mga Botox dito po sa crow's feet. Okay? Just to lessen po, para hindi tayo magka-accordion lines. Yung iba po kasi nakikita ninyo yung dito sa side ng eyes. Nag-extend na po yung mga lines. Tawag po namin doon accordion lines.
Oh, just like a musical instrument.
Yes. So, diba? May application. Right. So, sa middle third, yan po, itong crow's feet. And okay pa naman po yung volume. Okay pa rin yung laxity ng skin. But sa lower third po, ayan po, nag-i-start na nagkakaroon ng pagsag or jowls. So, i-prevent na po natin. So, the treatment that we will be doing will be the so-called COG threads for pulling, for lifting, and of course, we still say it's non-surgical. Injection lamang po siya. Yan. Ano bang gustong itanong ni Among right now before we do a procedure? Di ba? First and foremost,
Will I tolerate the...
yan pa. So what we do, actually, we numb the skin muna with the topical lidocaine cream. Kanina po, we applied already anesthesia.
Okay.
Now, we left it on the skin for about 45 minutes. Then, right now, we'll also still be using a lidocaine po. We have some itsy-bitsy injection ng lidocaine. Tiny needle lang po, tiny shot, dun sa area po na kung saan tayo mag-insert ng mga COG threads. Yan.
Oh.
So, actually, we also do surface land markings. So, we make a drawing po sa mukha ni Among. So, we'll be starting dito po sa right side. What we do kasi, if we want a pull dito sa lower third, meron pa rin tayong tinatawag na vector lifting. Yan. So, dito po sa harap ng tenga natin, we may start an injection point. So, what we're gonna do, kahit po 2 COG threads lang po kay Among, pwede na. Para mag-pull po yan talaga. Kasi pag nag-pull yan, Among, oh, di ba? Ano nang itsura natin? Younger. 10 years younger, right? So, we make an entry point here, 1 cm from the tragus ng ating tenga. Ayan po. And we make a diagonal line from here, down there. Dito po sa tinatawag na marionette line. So, draw lang po tayo ng linya. Ayan. So, precise po ang treatment natin, Among. Don't you worry. Okay, yung area lang po na ito-target natin, lower third. Dito po. Mayroon pa bang katanungan si Among habang ating...
Yeah, actually that was what I was about to ask.
Yes.
Will it also be... Are we going to do it on the other side? Para hindi mag-ano?
Oh yeah, we'll do it on the other side po to balance everything. Ayan. So, actually may study sila Among just for an information kasi some of my patients are asking bakit yung isang side ng face ko parang mas lawlaw or mas drop
Kaysa
or
sa kabila.
exactly. They did a study na kung saan po pala tayong mahilig yung paghiga natin. Yung tinatawag nilang side lying. Yung iba mahilig na right side silang pag natutulog. Naka-side sila sa kanan. Yung iba naka-side sa kaliwa. So parang yung pull of gravity. So yung area na yon ang mas nagsasag. So sabi nila it will be advisable kung straight ang pagtulog. But of course when you're sleeping it's so hard to have that kind of position, di ba Among?
Yes.
So dito rin po, same thing, we do a marking. Yan. So yung mga cog threads po na yon Among, actually, they're made of mga parang protein fibers. So, iiwan po natin sa loob ng ating skin. And ang ginagawa po nila sa loob ng skin, it will tell our skin to make our own natural proteins like collagens, elastins, lahat po ng responsible for skin tightness, skin firming. Sila yung, ang purpose nila is for structural framework. So,
Skin science have gone far, Dr.
Yes po.
My goodness.
Actually, noon, Among, di ba, if you could recall, noon, 1980s, 1990s, even early year 2000, ang alam lang talaga natin, puro surgery eh. Mga surgical facelift, surgical nose lift, doon lang ang talagang alam natin eh. But the latter part of year 2000, nagsisimula na yung mga non-surgical treatments. So, pumapasok yung mga fillers, and then itong mga nakaraang taon, pumapasok na po ang mga thread lifts. So, ngayon yung mga taong takot sa surgery, tsaka Among ayaw yung may scar dito sa, pag nagpa-facelift kasi mapapansin mo yan, meron silang mark, scar dito sa may around the ear area po. So, a lot of them don't want it anymore. Tsaka yung, when you do surgery, of course, talagang ibabanat, but then after the procedure, some people, they can't recognize them anymore, di ba? Parang nag-iba, parang hindi ko siya makilala. But with this one, it's still gonna be you. Yung proseso nito, natural pa rin po. So, yung appearance nyo, natural din po. Yan. So, right now, we have our surface land markings. The next thing we do, we disinfect the skin, we clean the skin, we clean with our betadine, okay? So, while we're putting on a betadine, okay, and in preparation po dun sa procedure natin, kami muna po ay magbe-break mga kasiyasay. So, wag po silang maglilipat ng channel. So, a while ago, we have applied the betadine on the surface skin and we'll be injecting this lidocaine to numb the skin. So, the entry point is over here, so we inject minimal amount of our lidocaine. So, this part of our face, Among, lower third, medyo yung skin natin nagiging lax na po. Nagiging loose. Pero siguro po, you observe naman po, napapansin naman po nila, no? And you wanted also to prevent it from becoming more lax or sag. So, yun.
Sometimes I attribute it to less sleep, you know.
Ayun po, that's one thing also. Pagka palagi tayong puyat,
Yes.
yan ang nangyayari. So, I'm just doing an entry point right now here. Okay. Manhid po, no? Walang naramdaman. Yeah. So, sometimes I use a small gauge needle and we have a cog thread here. Okay, it has an 80mm threads po and ito po yung ating i-insert sa loob ng skin. So, we're inserting our first cog. Okay, I'm just gentle in inserting po. We'll be using 2 cog threads for Among. Okay, gentle lang po ako. And then normally yung thread po iiwan natin sa loob. And absorption time po nito several months. Okay, medyo lang dito po sa may jawline. Okay, and we're almost done po with our first cog thread. Yan, okay na po siya. And then what we do, we pull it out. So, pull out lang po namin yung aming cannula. And, naiwan na po yung ating thread. So, this one po, we'll be cutting yung remaining thread lang po. We'll proceed with the second cog. How you feel po? That was the first one. Okay lang po? Okay.
Just like when I was something, I had a procedure already.
So, we'll proceed with the second cog thread. So, like, ano lang po, 1 centimeter below doon sa ating first.
How many are you inserting the product?
Dalawa po na cog on one side and 2 on the other side lang po. That's enough po for your lower third po. Some po, we insert 3. And then the others, pag yung may mid-face sagging sila, we also insert 3. Pero ang focus po natin yung lower third po ninyo. So, you feel this po? Okay lang po? Numb? Okay. So, with the help of our lidocaine, numb po yung ating insertion na hindi nararamdaman. So, ayan po. We just follow a 1 centimeter line. So, below the first insertion, 1 cm lang po. And then, we proceed with the second cog. Compared po dun sa mga dati namin ginagamit na mga threads, kasi these are thicker, stronger, actually much better po ang kanilang pull, pag-lift, pag-tighten. So, these are stronger threads. Before po, we were using yung mga monofilament, yung mga maninipis na ating mga threads. So, we're inserting yung ating second cog. So, we just follow po yung ating plane of tissue sa loob. Okay. So, the good thing we're using a cannula. Cannula is blunt. It's not a sharp needle. So, it's just gonna traverse into our tissues. So, nararamdaman ko na talaga among yung laxity ng inyong skin. So, this will really help you po to pull, to tighten, to lift. And, of course, i-prevent natin yung mga jowls. So, no need for surgery. This is just injection. Well, they say that this mimics surgical procedure po. Okay, and I'll be pulling na yung second. And so, we're done with our second cog. Ayan po. So, we just press. And done na po, among. Done na ang iyong right side. Nakikita mo na lang to as time passes by. Nagta-tighten sa loob, nagpi-firm sa loob po. So, we have excess threads here. Actually, tight na po. And what we're gonna do, we do a cut. We cut lang po yung ating excess threads. So, yan po ang ating cog thread. And the second one, ayan po. Tight na po siya sa loob. Actually po, these coming days, you'll feel na tight na yung skin po ninyo. Nagli-lift pa siya. Ayan. And we're done. Yay! Congratulations! So, that's doing the ating right side. Okay po. So, there's a sensation lang po na yung pagpasok ng cannula naramdaman nyo po. But actually, ito po, mas magli-lift, magta-tighten. So, sa panga lang po, yung area ng ating pag-pull. Okay? So, same thing we do on the other side. Are on our last strand of our cog thread, and I have pulled the cannula here, and again we'll be cutting the remaining strand. Okay. So actually I'm just doing a pulling on the skin po, and itong threads po hinihila ko so I can feel na po yung kanilang pag-hold sa loob po. So we'll cut one by one. So this is again non-surgical facelifting using cog threads. Okay po. And last strand. And we're done po, Among. Thank you so much. Congratulations. Oh, diba? This is still non-surgical. Although we say it's minimally invasive po. Yan. So, ang ating Among ay nakapag-overcome ng isang procedure na facelifting procedure.
Wow.
Wow!
Will I notice anything on my face after this?
Well, actually, this one po, some of my patients were saying, yung mga dumarating na araw, nakikita nila yung pag-pull, pag-lift, pag-tighten po. So, unang-una yung mararamdaman po, na parang humihigpit sa loob, nagta-tighten po. It's normal tomorrow po, Among, you'll feel parang bugbog lang or some tenderness dun sa area. We just do ice compress po and just take some analgesics, yun lang po. So we are done with our NCOG threads, the non-surgical facelifting using the VLIFT threads. Kamusta, Among?
My goodness, I cannot believe that you did all of that without me feeling anything.
Okay.
Yeah, you were, it was done with grace. You were.
Yes po. Gentle lang,
gentle,
of course.
oh,
Yes.
ano.
Yes.
I knew that something was happening, no? But I
Right
could
po.
feel it, but
Yes
I didn't
po.
feel the pain. Oh.
Yeah, I already had experienced that, Among, kasi ako rin, yung pinapasok yung cannula. Alam ko may pumapasok, pero komportable lang po ako. And I was able to tolerate the same kind of procedure as well. Kasi pagka ganitong, ako, I'm 40s, si Among 50s, ayan. So, prevention na po yung ganitong mga treatment. At least non-surgical pa rin, although we say it's minimally invasive. But of course, these are still safe, they're very effective, and we have already FDA approval po ng mga ito. They're scientifically studied, clinically studied po ang mga ganitong treatments. Alright. So,
Thank you very much. Thank
pang
you.
last question ba si Among? Patungkol dun sa ginawa natin ngayon?
I'm very concerned about the maintenance. What do I do to, you know?
Yan. Actually, with this kind of treatment po, kasi naiwan na yung thread sa loob, we'll have the thread work its effect. As time passes by, nanonotice nyo pa, pabata pa ng pabata, nagkakaroon pa ng collagen formation and further tightening and further lifting. We only inserted 2 cog threads into sa isang side, and then sa kabila, 2 pa lang. Actually, we can still add more like after a year if you want some, parang booster na lang po. That's optional also. Yes. Kasi po, Among, pag nakita nyo na yung resulta na yan, baka bumalik pa po kayo for more. Yeah, some of my patients, Among, are like that. They have tried it, and then nung nakita nila yung result, they want more. They come back for this kind of VLIFT threads treatment. O, ayan mga ka-CSA, meron na naman tayong natutunan sa CSA. And Among, meron po ba kayong mensahe sa ating mga manonood? Yan. Right.
First of all, Doktora, thank you very much.
Welcome po.
Thank you to
You're
your
welcome.
Sadyan. Thank you very much.
You're welcome.
So as I told you earlier, skin science has gone very
Yes,
far,
po.
no? And
Yan, support natin si Amang. Yan, yan. Okay na po yan, Amang.
sa ano naman, in the realm of our faith,
Yes.
ano naman talaga na naman dapat may binigyan tayo ng talent ng ating creator, no? Para
Amen.
makapag-enhance
Correct.
ng images natin, ano? So this is a welcome development in skin science. So thank you very much. And
Yay.
what do you call this now? I'm encouraging you to try it, you know.
Opo.
I'm encouraging you to try it.
Yeah.
I was very anxious earlier. I was having second
Yan po.
thought whether to proceed to
Yes.
pero after the procedure,
Okay na.
Okay na. Oh, thank you.
Thank you po. Maraming salamat. And of course, we are instruments ng ating Panginoon sa ganitong mga klase ng treatment. And we always give glory to our Creator. Yun po. So, kayo mga kasiyase, kung meron pa po kayong mga katanungan, mga comments or suggestions, you may email me at csaskinclinic@yahoo.com. Ang aming clinic po ay matatagpuan dito sa 2nd floor Pure Gold Dau Building, Dau MacArthur Highway, Mabalacat, Pampanga. Ang aming mga contact numbers naka-flash po sa inyong screen. And maraming salamat po sa aming mga sponsors, Restylane Philippines, Skin Medicine Incorporated, Menarini Philippines, Galderma Philippines, and maraming salamat sa aking CSA family. And of course sa inyong lahat na patuloy na tumatangkilik ng aming mga episodes. So abangan nyo pa rin po. Marami pa rin kaming ihahandang mga bagong topics for all of you. Sa mga ka-CSA, when it comes to natural beauty, you can trust the CSA Certified Skin Authority.